Good afternoon, everybody. Welcome to our last webinar for our VIVE Grant. Thank you guys so much for joining us. My name is Dr. Ayana McIntosh. With me is going to be Dr. Alicia Moorhead G and Princess Juan Durbin. So thank you guys so much for joining us. We're going to be starting in just a few minutes. So today's message is about next-gen PrEP and PEP and with clinical updates. We're going to be discussing youth-friendly approaches to HIV prevention. As everybody is completing the pre-survey, there are just some tidying up that we need to do, some introductions. Next slide, please. Oh. So we're honored to be joined today by two leaders who bridges the community engagement and clinical innovation in HIV prevention. Dr. Alicia Moorhead G is a physician leader and innovator dedicated to improving access, engagement, and outcomes for marginalized population. She serves as the medical director of inclusive care at AltaMed Health Services, where she leads population health strategies and develops inclusive, patient-centered care models. Her work includes integrating PrEP into more than 40 primary care clinics, establishing collaborative pharmacy agreements, allowing pharmacists to independently furnish PrEP in 12 different pharmacies, and training healthcare teams to deliver equitable, affirming care. Dr. Moorhead G received her medical training through the Charles Drew UCLA program, completed her residency at UCSF with a focus on health equity, and holds a master in science in health policy and management. Princess Juan Durbin is a global health scholar, Gen Z public health leader, and community leader with deep expertise in youth-centered HIV prevention and health equity. He currently serves as the Vice President of Community Health and Partnerships in the Southern Legal Center for Youth, and is the founder of the Atlanta Kiki Leaders Fellowship and Southern Kiki Leaders Collective, which has reached over 500 LGBTQ plus youth across the Southern US. His work centers culturally relevant, community-driven approaches to PrEP access, public health education, and systems relevant to community-driven approaches to PrEP access, public health education, and system changes, particularly with the Black and LGBTQ plus communities. Princess is also pursuing a Master of Science in Health Equity at Meharry Medical College with research focus on youth-led HIV prevention and health systems accountability. Together, their perspectives offer a powerful lens on how community trust, clinical practice, and systems level innovation can expand youth to next generation PrEP and PEP usage. So welcome our speakers. Thank you guys so much for joining us for this very important message. So this knowledge,
Hi everyone. Yeah, I would jump right in. I want to go ahead and give my financial disclosures. I currently, at this moment, have no relevant relationships or ineligible companies to disclose.
And I'm a part of the Gilead Sciences HIV Prevention Speakers Bureau, but I won't be talking about any branded or pharmaceutical meds any branded pharmaceutical meds.
next slide. So this knowledge-based activity will provide an overview of current CDC and USPHS recommendations for both oral and long-acting injectable PrEP and PEP. This session will emphasize the pharmacist's role in HIV prevention and explore practical strategies to engage with the youth in meaningful and age-appropriate conversations about HIV prevention and care. We will review clinical considerations to tailoring PrEP and PEP regimens to adolescent and youth adult populations, including consent, dosing, and counseling strategies. And we will also be learning from our amazing speakers how to build rapport, address barriers, and create accessible prevention pathways that empower youth to making informed health decisions. Next slide.
All right, everyone. So I'm going to set the stage for our conversation this afternoon or morning, depending on where you are. We'll be talking about youth, and we're defining youth between the ages of 18 to 24, navigating identity, relationship, and health decisions during critical development years, and then also the diverse experiences of these young people, whether they're LGBTQ youth, whether they're brown, Black, persons of color, or systems involve youth with unique barriers. And so the stakes at this time is that 18.8% of new HIV diagnoses are from youth ages 13 to 24. 13.2% of PrEP prescriptions are prescribed to these young people versus the 20.3% that are actually PrEP eligible. And so we know, and we'll be able to expand through this conversation, the multiple intersecting barriers to care and prevention that young folks within this frame kind of experience.
And to reiterate Princess's point, this graphic shows that nearly 1 in 5 of all new HIV diagnoses were among adults and young adults and adolescents aged 13 to 24 in 2022. And so we do want to address this group because they do have vulnerabilities to HIV, and we can prevent HIV among the group.
All right, so how to have conversations about PrEP with young people naturally. So you shouldn't come to a young person and say, hey, you should really consider PrEP. It may sound good in retrospect, but if you're coming to a young person that has no idea what PrEP is, it's coming across that you're telling them what they need versus inviting them into the conversation. And so a more actionable approach would be, what sexual health prevention tools are you aware of or use? Next point could be, don't say, are you sexually active? That's so abrupt. It's so clinical, right? Somebody just is just like, are you sexually active? I'm like, I can't define what that means, right? I don't want to define what that means. And then also, this is for high risk individuals. So framing PrEP as only for high risk individuals, one, is extremely stigmatizing because PrEP is for everyone, regardless of if you're in a relationship, regardless of if you're single, if you're a sex worker. PrEP is for everyone, and we need to make sure that we're censoring that within our work. The next is launching in statistics and side effects first without really engaging the pure kind of like framework of PrEP. And so some more natural ways to be able to have those conversations is to invite the young person in. So asking how can you support their health goals and introducing PrEP and PEP as a prevention tool that anyone could use. And then again, lastly, inviting them to have a conversation to learn more about PrEP. And so the goal overall is to make sure that PrEP is a normal part of the health conversation and not a special intervention that's needed for reserved lectures, because again, that further stigmatizes HIV and PrEP and PEP.
This is a graphic that shows PrEP coverage among the youth in the US. So as you can see here, only 1 in 4 youth aged 16 to 24 who could benefit from PrEP actually were prescribed it. And on the bottom side, on the bottom part of the slide, you can see a graph that shows PrEP use by age group. And as you can see, those aged 16 to 24 had the lowest PrEP coverage compared to other age groups. So it's definitely an opportunity for us to increase PrEP access for these this group.
All right, so the reality gap. Let's talk about what policy says versus the actual experience. So I'm not going to use policy language directly because we're all from different places, but I'm just going to summarize, right? So policy could say that access is available, that we're funding clinics, the services are listed. If you go on the CDC website and you type in your zip code, you're going to see a populated group of organizations you can go to and get some testing, right? But the young person's experience may be that there's no way for them to get there. Transportation may be limited. It may be in inconvenient hours. They may close at 5 p.m. And guess what? I'm in basketball practice until 6 o'clock. So I can't go regardless if I have a game or practice, those are hours that aren't convenient for me. And next is stigmatized spaces. A lot of times there are within community spaces and organizations that people may frequent, and so it becomes like, oh, that's the HIV, that's the HIV center, or that's the HIV space, right? And that really could push young people from engaging because they don't want to be grouped into a stigmatized group. So that's even further conversations about how we're engaging young people. Next could be consent laws protect minors so that there's legal frameworks that are in place to protect young people. But all young people are always thinking, right, if they're with their parents, what does disclosure look like? Will my parent find out because I'm on their insurance? Or, will my parent find out we've never had a conversation about sexual health? And so I live in a religious household. So if my parents even knew, I was LGBTQ or that I was even considering thinking about like sex and options, right? What that could mean for me in my home and my actual experience. And the next policy implication could be PrEP is free or low cost. There are programs and insurance cover costs, but a lot of times, like I said in the previous experience, right, I could be outed by my insurance company if my parent wanted to call and understand the plan and they had to confirm something. And if I'm a minor, if I'm under 18, right, what does that look like for me? And so that's the overall kind of like reality gap between what policy could be and how it's the framework of policy compared to the actual experience of a young person navigating their sexual health.
In the last two columns, you need to establish a relationship with the clinician and gain prescribing authority under a standing order. So, with those, you probably also do need to do a training and then find out in your state what the law is as far as what the requirements are for the standing order.
Although there are different options for PrEP and PEP, with adolescents, as Princess mentioned earlier, maybe they don't want to tell their parents. Maybe they don't want to be outed or show that they are sexually active. So there are some different options that we can talk about. And today we're going to be discussing the long-acting injectable PrEP.
I can talk a little bit more about LAI. So when taken as prescribed, LAI is 99% effective in reducing the risk of acquiring HIV from sex. Injectables can be used especially for people who have problem with oral PrEP or taking oral PrEP as prescribed, prefer getting an injection instead of taking oral PrEP like myself, and may have serious kidney disease that prevents use of oral PrEP medication. And so returning for subsequent injections is necessary to maintain protective levels of LAI. And in trials, HIV acquisition have occurred among people who have delayed receiving their injectables for several months. So that's if if you're taking an injectable that is within a certain time period and you're kind of going outside of that time period, of course, the efficacy of the medication is going to be less. Next slide. All right, so shifting the power dynamics, talking about the challenge, right? Daily oral PrEP or PEP requires control over your schedule and your privacy and storage and consistent access, luxury that a lot of youth don't have, right? And so when we're talking about LAI, the privacy is that there's no daily pill that they need to hide. The autonomy is that there's flexibility of injections, which would reduce barriers. And an empowerment aspect is that youth are able to control the timing of their clinic or provider visits. So they're actually able to, one, create a schedule that they're able to maintain that they have autonomy over. A next option for oral PrEP, if not taken daily, is the on-demand 211 PrEP. So 211 PrEP essentially is you take two PrEP pills before 2 to 24 hours before you have sexual contact, and then one PrEP pill an additional day after that, and then another pill a day after that. And so that's really good for folks who may not be sexually active, consistently, where they feel that they need to take oral PrEP every day. Is really just another form of another way to take it. So you take it only when needed. And discretion is less likely, is less to explain or hide. You can have your 4 pills, you'll be gone with them 4 pills within 4 days. And so these options really shift power back to the youth, and it reduces dependence on adults and schedules that they can't control in spaces that may make them feel unsafe.
So, when we talk about HIV prevention in adolescents and young adults, one of the biggest challenges to that care is healthcare being organized in silos. The reality is that policies and even data systems are often designed to operate separately. So, with us being here today, myself being a pharmacist, Princess being in community engagement, and Dr. Moorhead G being a physician, we are using this conversation to really break those silos and not only tell from our individualized perspective, but how we can intersect that and really join forces to be a positive influence for the youth and young adults. So, Dr. Moorhead G, please tell me how, as a physician, you're helping the youth and then using your physician position to really branch that gap to then partner with the pharmacists, the nurses, and people of that nature.
Yes. So first, I train other primary care providers. I'm an internist, which means I'm trained in internal medicine. So I see adults starting at age 18. But I train our pediatricians who are establishing relationships with patients much earlier so that they are aware of how to prevent HIV among their patients. And then once the patients transition to me, I continue that conversation with them. However, a lot of access begins outside of the doctor's visit. So at my organization, Ultimate Health Services, we have PrEP navigators, which we'll go over later, but they help with meeting community members out at different fairs, parades, like looking at Pride and other key moments to reach people. And they have a peer-to-peer exchange with different age groups. So we have young people that we hire who can go out and talk to the young people, and that's probably the biggest key to getting young people in and getting them aware of PrEP and getting them in to get that prescription, because you're taking out the power dynamic there. You're shifting the power dynamic. You're allowing young people to talk to other young people that they can relate to so that they don't feel stigmatized. They don't feel talked down to. They're talking to someone on their level and they're more comfortable with having those conversations about sexual health and starting PrEP.
And I love that you brought up stigma, because that's another major barrier that we as healthcare providers are facing when we're dealing with the youth. So, Princess, how inside of your role are you able to jump over that stigmatism?
Definitely. I would say that the way that we're really able to jump over the stigma is having honest conversation and allowing people to express their views and what they think in a way that is non-judgmental and that is allows them to be educated. As a young person myself, um, I'm 27, but when I was younger, when I was kind of like starting off in undergrad and coming out, transitioning out of a pediatrician, right, I didn't really know how to have a conversation without my mom in the room with me, with my doctor, right? And so it was a little like scary, it was a little like difficult, but what I really was able to lean into was like my friends. We really like had conversations with each other about our health, and then we were able to like take those conversations and then be able to like go to our like peer navigators that were also on campus to help us navigate those conversations. So I think it's important that we really give young people the autonomy to be able to lean on each other as well, because we can answer our own questions better than a lot of people. Not providers though. And I'll say this, I love pharmacists and I've met so many amazing pharmacists on my public
That's
health, community health journey. And I know that pharmacists are going to be key to allowing us to end the epidemic because they are the closest providers to community outside of like primary care doctors. or emergency doctors that like see people in the emergency room. But that's just my caveat.
And then even when a young person does get connected, we often see very weak referral pathways. So, Dr. Moorhead G, can you go into how we can either strengthen the go-between between from you being a physician to how you partner with pharmacists or how you partner with nurses so that we can start building our referral pathways?
Yes. So, as you mentioned, the referral pathway can be riddled with barriers. One would be the wait time to see an actual clinician. If somebody wants to get an appointment with me, unfortunately, they're going to have to wait a month or so or longer. But with pharmacists and with pharmacies, often that's a walk-in opportunity for a patient. So what we did at Ultimed is we built out a pharmacy prep program where somebody can come in and request PrEP and PEP, and they get it that day from the pharmacy without having to see a doctor or a nurse practitioner for a formal appointment. And the way we did it was through the California law that allows pharmacists to furnish PrEP and PEP independently, but we partnered our pharmacists with our PrEP navigators. So the PrEP navigators are the young folk. They go out and they find individuals who might be interested in PrEP. They bring them into the pharmacy. They perform a rapid HIV test to make sure the patient is eligible for PrEP or PEP. And they ask the patient, like, what when was your last time being exposed to HIV? Because we know that if someone was exposed to HIV within 72 hours, then they qualify for PEP or post-exposure prophylaxis. And so that's going to, help them and the pharmacist figure out what to give the patient, PrEP or PEP. And then after that, with making sure the patient meets eligibility for PrEP and PEP, so basically making sure they don't have any known kidney disease because we're giving out oral PrEP and PEP, and they have a negative HIV test, then the pharmacist can give them their PrEP or PEP that day, counsel them on the medications, and the PrEP navigator actually schedules the patient for a follow-up appointment with the clinician. And so in that way, we're taking away that wait time. We're getting patients access to PrEP and PEP same day, and we're able to provide a fully multidisciplinary team to meet the patient where they're at.
And you bring up a great point. When providers collaborate across disciplines and settings, prevention really becomes more accessible, more affirming, and more responsive to the young people in their real lives. So that was amazing. Thank you so much.
All right. So speaking of pharmacies, now pharmacies are more accessible to people than clinics are. Nearly 90% of Americans live within 5 miles of a pharmacy. And this is why there's been more of a push for pharmacists to independently give out PrEP and PEP. Pharmacists are consistently rated as one of the most trusted healthcare professionals. And we do have a physician shortage. So with pharmacists expanding their roles, working at the top of their license, they can actually help with addressing some of our issues in primary care. You also have the ability to reach patients who can't be reached by other providers. You often have better relationships with patients, and you have more accessibility as far as being there on a walk-in basis. And so we went over the states that allow pharmacists to independently initiate and start and administer PrEP and PEP. But also, even if you're not in one of those states, we're going to talk about CPAs or collaborative practice agreements that help you to establish the ability to give out PrEP and PEP. Now, either way, I do want to talk about PrEP navigators. We did mention them earlier, but PrEP navigators are basically peer navigators that share racial, ethnic, sexual, and or gender identities with patients. and they're trained in HIV testing. They can do counseling on HIV and STI prevention and treatment. And also, they can help patients get PrEP or PEP without paying anything. There are plenty of payment assistance programs out there, and the PrEP navigators are trained in how to get someone signed up for those so that they don't have to pay for their PrEP or PEP. With our program, the PrEP navigators actually do the eligibility screening with the patients. And so with that, they're providing non-judgmental encounters that increases the patient's comfort in discussing PrEP and sexual health. And it decreases those barriers like stigma, bias, and discrimination. And research has shown that PrEP navigators are preferred by patients. So Black and Latino men report a preference for navigators with similar lived experiences, and Black and Latina women are more likely to start PrEP with benefits navigation services. And the way that you can get partnered with PrEP navigators is to look up the community-based organizations in your area and see if they have PrEP navigators.
All right, so thank you, Dr. Moorhead G. My favorite part about this conversation personally is going to be really about how to build trusting relationships with young people, right? And so let's talk through a couple of those ways. Leading with community and not with clinics. So that's partnering with trusted community organizations and people, right? A lot of folks in community trust organizations, but they trust people more, right? So linking up with someone of community who may be a community influencer digitally, or maybe someone that's really kind of like seen as an elder in community, or someone that's trusted, and engaging with them and allowing them to lead conversations that meet young people where they are. Next would be peer navigators and youth voices, like Dr. Moorhead G said, really empowering youth navigators. I started out as a peer youth navigator when I graduated from Morehouse, and that completely changed the trajectory of my career, and of my work. It empowered me as a young person with the education and the knowledge that I needed, and the ability to be able to translate that knowledge into the language of my community. So I'm a part of ballroom, so I can have a conversation with one of my ballroom peers about PrEP in a way that probably will sound very foreign to you, but would sound so accessible to us. Next would be transparency. It's so important to lead with confidentiality limits, and kind of like what parameters are as you are a provider, right? You still have to maintain, and young people should be aware that you still have to maintain a level of professionalism, and you are a provider, a doctor, whatever the case may be, or a pharmacist. And so that level of kind of like rapport still needs to be respected. But understanding that like I can trust you is so important. Next will be normalizing HIV prevention. So talking about PrEP and HIV, like well, PrEP in particular, or PEP, like you would talk about any other prevention tool. We talk about like Dr. McCant said in the chat, and we talk about the morning after pill, or we talk about, different other medications or prevention tools that may be sexual in nature, but may not be HIV focused, right? We have to normalize this as a part of an overall conversation. The reason why I really love kind of like the reproductive justice movement is that incorporated all of that. That incorporated abortion rights, that incorporated HIV, that incorporated maternal mortality. It incorporates so many wide ranges of things that really normalizes conversations. So wanted to hats off to that movement. And lastly, active listening is trust building. So ask young people what they need and actually listen to what the response is, and let your direct action or response be from what you heard and not be from what you think you wanted to hear. And that's so important, as am currently in my master's program building out my capstone project, working collaboratively with providers and community members, and bringing us all to the table to be able to have conversations that not only move the providers forward and their knowledge and their ability to be able to create better access and be able to serve community better, but also for community to also learn about what providers do, how they're able to do it. And I know as someone that has come up in this movement and in this work, that means all the while. And I mean, we're all here having this conversation together because we all want to learn more and extend grace and learn how to engage young people where they are. So those are my tidbits, 5 tidbits from Princess Jawan. This is not Bible, it's just 5 things that I plucked from my brain. So definitely feel free to build on and expand those. Okay, I'm gonna keep going. So what youth friendly actually means. So moving beyond buzzwords to actual like practice, right? Theory versus practice is so much different. That's why I'm doing a capstone. And so respect, right? Using correct names and pronouns. So don't ask, assume, right? And I didn't say my pronouns when I started, but my pronouns are all of them. So he, she, they. But privacy, clear confidentiality policies, and no surprise parent calls, right? Like if you have to tell a young person if there may be a risk for disclosure, being honest about that, right? So that young people are aware and that they're not caught off guard because sometimes it does happen. Because if you share something with me that may, conflict and may hurt your safety or someone else's, that's where a line is drawn. And so those conversations are important to make sure that we're having. Using sex positive language, so making sure we're meeting youth where they are. And flexible hours. Access is so important. A lot of people are not able to use a lot of clinics because they're open during working hours, right? And so access is so important. So being able to be flexible and being able to be understanding with your flexibility is so important. So healthcare systems can often fall short too of assuming heterosexuality or cisgender identity. We shouldn't assume anything. PrEP is for everybody, so it doesn't matter what you like, what you don't like. PrEP is for you. Requiring parent guardian involvement for minors without explaining consent laws is a big no-no. And using clinical language that alienates and confuses rather than educate. And I had to get out of that myself, right? Like once I was entering academia and like doing a lot of research and like writing academic papers and having to use a certain language, I started using that language with community. And I had to have a young person tell me like, Princess, I don't know what you just said. I was like, wow. I have to take more time to ensure that I understand what I'm talking about to be able to translate it. And so that's important. So when we fail to address kind of those structural barriers as well, like transportation, cost, and scheduling, it can really compile all those issues.
So, as Princess just mentioned, we are noticing that one of the biggest reasons healthcare systems fall short in HIV prevention, especially for the adolescents and young adults, it isn't the lack of medication. It's a combination of stigma, lack of provider training, and systematic barriers. So, what we would like to do is have a simple framework that we can use in practice. Normalize, which, as Princess just mentioned, normalize making sexual health conversations routine. It should be something we talk about preventive measures with the flu, getting immunization. So we should just be really normalizing this type of conversation. Affirm, again, Princess just mentioned, making sure that you use their proper pronouns, not just assuming, but actually asking so that we can make the youth comfortable to talk to us and let them know that we're here for them. And then refer. If it's outside of your clinical scope, don't be afraid to tap in another person. We are all about breaking silos and making sure that we are really thinking about the patient and how we can help them on a path to better health. So we're just going to, in the chat, we can talk about ways that you guys would feel more comfortable discussing health with patients under 17 years old, and then we'll talk about that at the end.
I want to talk about how you can take the things that you learned today and start working on furnishing PrEP and PEP. The main key to that is collaboration. So if you are in a state where you're able to independently furnish PrEP and PEP, it could be daunting to think about how to get started with that. So it's best to reach out to a local clinician or community-based organization. Either one can have PrEP navigators and start meeting to discuss how you can plan to start furnishing PrEP and PEP. So when you set up the meeting, you want to talk about your goals as a pharmacist. So that could include practicing at the top of your license or improving patient care and access. And then you want to develop regular communication with that clinic and or CBO. Then you can create an agreement. So there are templates online on CPAs or collaborative practice agreements. You can establish that with a local clinician, and that can be done even in the states that we didn't show today. We do have a slide where it shows all of the states where you can do a CPA, which is a majority of the United States. You can find the template online, create an agreement with the clinician that outlines what your responsibility is and what the clinician's responsibility is. With a CBO, it would be a little bit different and a little bit easier, honestly. It would be a memorandum of understanding with the CBO just to understand who is doing what. Typically, you want to say, okay, so the PrEP navigators are going to do the rapid HIV testing. They'll talk to the patients about HIV STI prevention, and then I'm going to talk to the patients about the actual medications. And so, with multiple meetings, you can establish a PrEP and PEP protocol. And on the right-hand side here is the protocol that we use at Ultimate. And so we do have a paper that's published, and you can go access the paper. It lays out exactly how we built the program and what the protocol is. And it might look complicated here, but when you actually start doing the PrEP and PEP furnishing, it gets pretty simple because you have every contingency laid out. You have everything laid out so that you know what to do in the case of different scenarios. So these are the states where you can do a collaborative practice agreement. So give us a thumbs up if you're in any of these blue states. They're all the ones that are colored blue. You can do a CPA. Awesome. Awesome. I'm seeing a lot of thumbs up. So these CPAs are formal partnerships between pharmacists and clinicians. They allow pharmacists to expand their services, and it includes anything. It doesn't have to be PrEP or PEP, but you can specify it for PrEP or PEP. But it can include physical assessments, medication initiation, modification, or discontinuation, lab orders, point of care testing, and vaccine orders. And it's approved by most states, as you can see. And so in my health system, we started with doing CPAs with our pharmacists just to do refill requests, just so that the providers wouldn't have to always do the refills. If it was an easy refill that, you didn't need like extra lab testing or anything like that, the pharmacist could just refill it with our under our license. And it would say that I filled the medication, but you can see that it was actually filled by a pharmacist. So that's how we started our CPAs. And then we used that to guide our pharmacy PrEP and PEP program so that we could have our pharmacists not only do the medication orders, but also order labs for the patient to get after they get the PrEP. And so you can read more about CPAs online and find a local clinician that might be interested in partnering with you for that, because that can help them get more business as well, where the patient will follow up with them after they start a medication with you. This is some information about the pharmacy PrEP PEP program that we started. So in California, pharmacists can independently furnish up to 90 days of PrEP, oral PrEP, and the full 28-day oral PEP regimen. And so we started off our pharmacy PrEP program in 2021, starting it at one pharmacy, and then we gradually went pharmacy to pharmacy and did trainings, and now we're at 12 pharmacies. So those are 12 places where people can just walk in and get PrEP and PEP that day. Our PrEP navigators actually lead the program because they help the patients get in, they do the rapid HIV test, and they do the eligibility assessments and counseling. for the pharmacists actually review the eligibility assessments that are performed by the navigator. They make sure the patient is eligible for PrEP or PEP, and they furnish the PrEP or PEP and counsel the patient on the medications themselves. And under a CPA, the pharmacist actually order the recommended lab test for PrEP and PEP so that the patient can get the labs done either at outside lab or at their follow-up appointment with the clinician. In California, we actually can bill for these services. So our pharmacists write the note, they add the CPT coding for billing, and we do get some reimbursement back for the pharmacist encounter. All right, so for our summary today, we want to reiterate that 1 in 5 new HIV diagnoses are among adolescents and young adults. And PrEP can prevent HIV, but it's underutilized, especially among youth. We saw that youth have the lowest amount of PrEP coverage compared to people of other age groups. We also know that pharmacies are highly accessible. They're more accessible than clinics. And you saw the states that allow pharmacists to independently furnish PrEP and PEP. And so you can look at the laws in your state and look and see what the requirements are for you to get started. Even if your state doesn't allow you to independently furnish PrEP and PEP, the vast majority of states allow CPAs. So you can find a local clinician to meet with them regularly and establish a CPA and start furnishing PrEP and PEP through there. And so we really want to let you know that collaboration is key for all of this. Even if you're in a state where you can independently furnish PrEP and PEP, it can be busy. So you want to add on collaborating with community-based organizations, PrEP navigators, so that they can take some of that load off of you and you don't feel overwhelmed with offering this new service. When you do collaboration, you can increase access by getting the people who often work with the youth. They're often out there, they're doing the rapid HIV testing, they're talking to the youth about PrEP and PEP. You collaborate with them, it makes your life easier to start giving PrEP and PEP. And it makes their life easier because after they talk to someone about PrEP or PEP, then they can direct the patient over to you to actually get the medication.
So for our next steps, we just want to encourage everybody that was on this session to adopt status neutral care. So shifting from that siloed prevention treatment models to a more uniformed approach. Don't be afraid to reach across healthcare lines so that we can provide a more wholesome treatment for our patients. We really want to strengthen community-led services. So really partnering with, like Dr. Moorhead G mentioned, those peer navigators so that we can really have youth speaking to youth. So now we're going to move to question and answer. So if you have any questions, you can unmute yourself or you can add them to the chat that I can read aloud to our speakers.
My name is Dr. O. I am a physician in Maryland. I wanted to get some feedback, especially from Dr. Moorhead G or anybody. How are you introducing long-acting injectables as a tool of PrEP? Because PrEP is still kind of new to some people, even though it's been out since 2012. So now I feel like I kind of have to sell it, when I'm telling somebody, like, here, there's this every 2 months, and then every 2 months. Now I'm like, there's this every 6 months. We could do anything for every 6 months. And people are like, I don't want this new medication. And it's like, it's not new. Like, how are you going around that?
I have the same conversations, honestly. My main goal is to have the patient know what their options are. And so I'll let any of my patients who are taking oral PrEP, I'll let them know that there are injectable options available. But if they say, I'm not interested in that, I'm just going to keep with the oral PrEP, I'm like, okay, maybe, we'll keep on with the oral PrEP. I don't want to pressure you into doing anything you don't want to do. And maybe we can revisit it at another time. I have other patients who come to me like, I want the injection now. So it's all about meeting the patient where they are, honestly. If they're on any type of PrEP, I'm happy. Whatever they want is what I'm going to give them. And it's going to take some time for people to get comfortable with the different options. We kind of want to get PrEP to be similar to birth control, where you have so many different options to choose from. But as long as they, whatever they want to take, I let them take.
Yeah, I can jump in really quickly there as well on a community level. I think for someone that is on injectable PrEP, I'm able to have conversations with my peers and people in general about PrEP in a way that I've been on both regimens. Like I've been on daily oral and I've been on injectable. And I say for me, I really don't like I don't try to sell anything. I'm just trying to empower you and give you options. Like I don't work for the pharmaceutical companies in terms of selling medications. So I'm not trying to sell you nothing. I'm just trying to let you know what the tools are and what tools work best for me. And I'm willing to help you navigate and figure out how those tools can work best for you. So that's how I engage.
Dr. Ford, you can unmute.
Everyone, I'm Dr. Ford. I am a nurse practitioner in the DMV, licensed in DC, Maryland, and Virginia, like my friend Dr. O. And so, my question is, how do you shed light on perceived ongoing exposure to HIV? That's something that I'm having an issue with. I'll um, offer and have this conversation about getting on PrEP, and let's say that this person just recently tested positive for chlamydia, right? And now we give them birth control, but they just are not ready to start any type of PrEP because they're apprehensive for the meds and the side effects, right? So, what are some strategies that you can provide some of us to not advocate for them, but not be so forceful?
I'll start. I have also had similar difficult conversations, and it is very challenging. I'll usually start off with saying, it's recommended for us to discuss PrEP with anybody who's sexually active. It is a tool to prevent HIV, and anytime you have sex, you could potentially get exposed to HIV. So this is a medication that can help you not acquire HIV. I've had those conversations with people who have come to me with STIs, and sometimes it works, sometimes it doesn't. What I've found is you need repeated appointments to discuss it regularly, and then also bringing in the PrEP navigators if the patient is comfortable with that. I think having those conversations with their peers is very helpful so that they can hear it from someone who they can relate to. So I usually try to connect the patient with a peer navigator who's going to give them a phone call and just talk to them a little bit more on a peer-to-peer level. And hopefully at the follow-up appointment, we can talk more about PrEP on the doctor-patient level.
And I will also sprinkle in when I engage other young people, so specifically with your comment, Dr. Ford, about your patient who tested reactive for a STI, I introduced the conversation of doxypep, right? And also align that as another prevention strategy that could be taken in conjunction with PrEP or PEP. So I think that the also a lot of people may have apprehension to the consistency of the medication. So like we said in our presentation, like the 211, that is a good, if that's something that you can look into to having your toolkit as a provider to talk with your patients through as well. I think that's a great form of being able to use oral as well.
I just want to thank everybody, and we are going to show the email addresses for our speakers today. I just want to again give a round of applause because they did a fabulous job allowing us to understand not only how to approach youth, but really how to interconnect across healthcare fields so that we can provide a better service to our youth today for HIV prevention and care. So again, I just want to thank you guys so much for joining us today, and that is our time.